Today I'm going to discuss how to deal with crisis or pandemic fatigue. We're living in a very special time. Right now we're facing many crises. And today is October 19, 2020. And based on the data from officials, there are more than 40 million COVID-19 cases. Among these 40 million cases, more than 1.1 million was died of this disease. And right now, the flu season is rapidly approaching us. We still don't have good measure to deal with both flu and COVID-19. And also, another is happening in the United States. We have presidential election, and that's put a lot of pressure on many people to make the right decision to elect United States president. And also there's massive job loss. Many people lost the job and don't know how they can get a new job. And also the healthcare system is stretched out in all over the world. So the healthcare professionals try their best to help people to save lives. And in the meantime, they almost risk their own life to carry out the job, because right now there's no apparent good tools to protect them. For example, the vaccine is not available for them. There's still a potential to get this disease when they take care of the COVID-19 patients. And there's a lot of unrest along the world. And the riches is also have cause some kind of trouble along the world. And now school season is start, and whether or not the kids should attend school in person is also big stress for many parents. And so all these issues is really cause a lot of stress, and it's not of to deal with. As a matter of fact, it's too much. In many cases, it is resulting in what mental health expert called crisis fatigue. So what is crisis fatigue? And crisis fatigue is when stress incidents become enduring or chronic. And the reason for this is that we human beings are not equipped to deal with the extensive period of stress or long period of time. Our defense systems are designed to prepare us for short bursts or emergency preparation, and that's usually called fight or flight response. So in this case, the pandemic is close to 10 months now, and that's caused every day with something new and caused not of response. And for this crisis fatigue, basically have 4 stages based on the mental health expert. And the first stage is the hedonic stage, and this stage usually everyone get together and people have taken some action and trying to respond by doing what needed to be done during the crisis. And so people just work together. And the next phase is honeymoon stage. And so people try to find a solution, to get some solution. And they feel good about being a part of the community, so because they find some solution. However, in the case like this COVID-19 pandemic, we already get into this crisis for more than 9 months. So individual get some kind of disillusion. So this is a disillusion stage. And because people start to feel physically and emotionally exhausted, and that many people have turned to agitation, rage, or despair, and very rapidly, and this get into the fatigue stage. As I mentioned, that human body cannot sustain long levels of cortisol and adrenal for a long period of time. And so if it takes so long time, this results in burnout, which causes a person to be easily tracked and complete withdrawal. It is also a stage when people are more likely to engage risky behavior and that are detrimental to the self and others. So this stage can last months or years. So that is a really tough situation for people to deal with, and that is it is not, as I mentioned, human beings have no mechanism to deal with this long-term crisis. So now we have this crisis. The question is, how can we deal with this crisis? First, the most important is to preserve your routine life. And that will help you maintain a sense of normalcy in your life. And find a new routine and stick to it as much as possible. And the routine and predict activity are powerful tools for you to overcome the crisis, because they create stability. And think about small ways you can create routines, like eating breakfast at the same time every day, or watching TV show with your family. And you also need to focus on things that bring you joy. And as you see that on TV, there's so many things happens, and most of them are not so happy. And so you need to focus on what is some happens in your life, no matter how big or how small. Whatever brings you happy, focus on something positive. And also important to stay connected with friends, family, and society. We know right now we need to keep social and physical distance. However, right now there are a lot of tools for you to connect with your friends and family. And most of the electronic tools are free. Try to be innovative so you have a nice conversations through the electronic ways with your families and friends. And take time to give yourself some self-care, and that's very, very important. And give yourself permission to take a break from stress, to engage in a healthy distraction or activity that find you in enriching or soothing. Remember that self-care is not selfish. It is a necessary part for you to return to your normal life, to maintain yourself healthy and self-energy. Yeah, it's important to have more activity, physical activities, so do some exercise, yoga, meditation, and select whatever you like the best and make yourself feel comfortable to do. Exercise at least 30 minutes a day, and let yourself breathe. Yeah, we know that life is changed, And this is significant change before pandemic and after pandemic. So the loss always bring grief. There's so much grief the life you had before the pandemic. Future plans you have made, important milestones you have been cancelled or postponed, and loved ones, safety, security, independence, and working life balance. The list is endless. And allow yourself to grieve. And also remember, grieving is normal and is needed. The word grief means a word acceptance. Nurture your feeling by offering yourself compassion and validation. Try use information and simple ways to help yourself learn to sit with the uncomfortable emotions. And again, to mobilize your own support system. And it's easy to become isolated when you feel overwhelmed. Talking with someone that you trust about the way all this stress is important to you, and help you stay connected. And of course, experience adverse reaction to intense, prolonged stress doesn't make you mentally ill. In fact, it makes you human. And there's no need to consider your crisis fatigue as something abnormal. And another thing is very important, that if you have lost something, persistent anxiety, trouble sleeping, hypervigilance, apathy, numbness, overwhelming emotional response that impacting your relationship or daily functioning, there's no need to suffer in silence. You need to seek immediate medical help, seek professional help, so they can help you unpack what is happening and help you move through your feeling and introduce additional strategy for you to cope with this crisis. Again, we are living in very, very stressed time, that the more and more crises will come in before it can become better. So we need to face this crisis. If you have crisis fatigue, face it. Don't try to avoid it. And so only you can take care of yourself and make yourself feel comfortable. And I guess we have some more time to deal with. Before we have vaccine, we'll continue to face this crisis. And that's because of crisis fatigue. And that's waiting for today. I wish everyone have happy and healthy. And I wish to see you in my next video. Bye.